Hello, my friends. I am back again. You might hear my kitties in the background. But we are here for a really, really cool live session today. So I'm going to give an opportunity for some people to join us. What we're going to do today is really, really near and dear to my heart, and it's also connected to my university. I am currently, but not currently, enrolled at the VCU School of Pharmacy. Go Rams, Virginia Commonwealth University in Richmond, Virginia, where I am a doctor of pharmacy student. And of course, I'm taking some time off to be Miss America right now, but I've gotten to do some really interesting things outside of the classroom. And my university is really a leading institution in addiction medicine and really understanding the science of substance use disorders and related kind of issues in the body. And so my university has had a researcher that has been working on a really wonderful project. And I'm going to bring her on, and she's going to share with us all about the paper that she just published. I'm so excited to be able to bring her on, put VCU Health on, and we are going to have Dr. Taylor O'Collick. Hi, how are you?
Hi, Camille. Good. How are you?
Thank you. I am doing well, and welcome. Thank you so much for coming on and talking to us about your research today. I haven't gotten to meet you in person, but I just want to thank you from my perspective about the research that you are doing in terms of opioid overdoses, particularly during the pandemic. This is something that has been, I feel like, a silent issue. And we see so much about COVID on the news, and that is very much an issue, but there are other issues within this. So welcome, Taylor. Are you joining us from Richmond today?
Yes, I am.
I miss Richmond very much. But I just wanted to give everyone an opportunity to get to know you a little bit. So can you share with us your background, what your PhD is in, how you ended up in this position?
Sure. So I got my PhD from the University of Vermont in experimental psychology, actually. And now I am doing a postdoc fellowship. So that means like after PhD, you get more research training. And my postdoc is in pharm tox, or pharmacology and toxicology. And I also do research in psychiatry. So it's very interdisciplinary work, and I really love it. Everyone here is very passionate about the research that they do, and that's really what inspired me to choose VCU for my postdoc fellowship.
And I also love VCU. I just finished my first year, so I am definitely a big Ram fan. And I'm curious, based upon your experience, what drew you to pharmacology and toxicology? Because that seems like a pretty specific topic.
Sure. So the reason I chose pharmacology and toxicology was because the department here really seeks to collaborate with other departments across the university. So that's something that really struck me. I do a lot of work in the Wright Center for Clinical and Translational Science, which again is a very like interdisciplinary center that connects researchers from across the university to help patients. So that's really what drew me to this department.
And for those watching who aren't super familiar with the scientific side of research, I'm a doctor of pharmacy student, and you are in the Department of Pharmacology, which seems similar, but are actually really different. So can you talk to us a little bit about what pharmacology really means and toxicology and how that might be different from what I do as a pharmacy student?
Sure. So pharmacology and toxicology were more on the like scientific research side. So how drugs, I mean, I think there's a lot of
There's a
cross
lot of
similarities.
similarities, but our practice is different.
Sure. So I study like pharmacology within humans. So how opioid and drug effects impact human behavior. That's really my area of interest, and how addiction affects the brain, and then different treatments to really help substance use disorder. So, and then pharmacy, a PharmD is like a clinical degree. So you're going to be actually helping patients in the community. So, I mean, there's a lot of different positions or careers that you can have with a PharmD.
Sure.
Definitely. But I think a lot of pharmacists also do scientific research, which I think is wonderful.
And I also love that you are a woman in STEM. Like I am really pursuing research. and making a difference. Did you ever question whether or not you wanted to be a scientist? I know that I loved it my whole life. Tell us about your journey as a woman in STEM.
Yes, it's definitely challenging to be a woman in STEM. I've been really, really fortunate to have a lot of women mentors throughout my career who have been more than transparent about their experiences and really open and receptive to sharing those experiences and challenges that sometimes come with being a woman in science. So I've been really lucky in that regard, and I try to do the same with my female colleagues, and we just have open discussions about things that might challenge us. So there have definitely been times that I questioned whether I wanted to stay in this or had doubts about myself and like how I could actually keep pursuing a scientific academic career. But I always talk to my mom as well and other female research scientists, and I think that's really helped keep driving me and help me like keep pursuing this route.
Good for you. I know I feel the same way. Having the mentors around us is one of the most important things I think that we can do. And I get to do that a lot in my job. But having other women like you be able to kind of be that role model for younger girls, because sometimes, especially the research perspective in science can be really overwhelming. And so good for you for keeping on and doing what you are doing, because when we talk about the paper that just came out, this is something that's so relevant and needed right now. So I'm curious to know kind of what inspired this project. How did you see this need, and what made you want to do research on this topic?
Yes, so one of the things that really inspired me to take on this project, we were already collecting this data. It's real-time surveillance of overdoses that are occurring in our local emergency department here at VCU. And so we had been collecting this data since last year. But what really inspired us to look into it during the pandemic and compare it to the previous year was actually our frontline providers. So we work with emergency department physicians and nurses, and they were seeing a lot of overdoses, a lot more overdoses they thought coming in during the pandemic, or when the pandemic started, really in March. So that's why we decided to look into this data. It was really like the frontline providers who were witnessing this, and I think that's definitely a strength and something that we as researchers can look into more, is like being able to communicate with the providers who might be seeing trends firsthand.
Yeah, and I've heard that from my perspective, since I'm talking about opioid abuse and overdose. And actually, so August 31st was Overdose Awareness Day, International Overdose Awareness Day, and September has been Recovery Month. And so I spent a lot of time with those who either have a family member or are personally affected with substance use disorder. And we've been talking about how this is getting worse during the pandemic. So share with us really the key findings that you all were able to determine, and kind of the methodology. Go through the whole scientific process for me.
Sure.
How you got your data, what you found, and kind of what the implications would be.
Sure. So we got the data from electronic medical records. So we work with the bioinformatics team here at VCU, and they send us the medical record numbers for people who were an opioid overdose that presented to the emergency department. And we get like daily reports twice a day. So we were able to get that data in real time.
Awesome.
And then we compared the number of overdoses from March through June of 2019 to March through June of this year, so the first 4 months of the pandemic. And we decided to like compare it to last year to have like seasonal control, and we just wanted to see how it related to what was going on at the same time last year.
Of course.
And then in addition to the number of overdoses, we also were able to pool different demographic variables. So we got race and ethnicity, age, gender, insurance status, so things that might be associated or just characteristics that might have changed across time. And then in addition to that, we also looked at what was actually going on during these visits. What was the response of the emergency department? So we looked at things like what percentage of patients were given a prescription for Narcan or naloxone to fill at their community pharmacy, what percentage of patients were given resources or a referral to outpatient treatment, and then what percentage actually ended up going into treatment. So I think those were all really important things to be able to look at. And then what we found, we found an 123% increase in the number of non-fatal, unintentional, so meaning they weren't suicide attempts. We just looked at accidental overdoses for this project. So non-fatal, unintentional opioid overdoses, we found an 123% increase from March through June of last year to March through June of this year, which is a very, very alarming number. And I mean, it's just shocking. And these are just non-fatal overdoses. We don't have the data yet for fatal overdoses, but there are reports across the country that fatal opioid overdoses have been increasing. There are different news reports about that trend. So this is data just from one hospital here at VCU, but this is definitely just one example of something that's probably a national larger trend in the US.
And that was one of the follow-up questions I had for you is, do you think this is representative of more than just Richmond, Virginia? I know that this is a problem nationally, something that I talk about often, both fatal and non-fatal overdoses. So do you think that this data gives us kind of a sense of what's going on nationally?
Yes, definitely. I mean, there is one other study that looked at emergency medical service runs, and that was in Kentucky, and they found the same thing, that the number of opioid overdoses increased from before to after the stay-at-home order, and that was in Kentucky. So, I mean, that's just one other example, and I mean, there are definitely, hopefully, going to be more reports about this topic, but this is definitely something that has been reported in the news that I've seen, at least in terms of other regions across the US, that there have been fatal opioid overdoses huge increases in fatal opioid overdoses and non-fatal. So,
which is so sad, and it hurts my heart, which is what kind of we talk about. You spoke about Narcan, naloxone, which for those of you watching who don't know what that is, it is the opioid overdose reversal medication. And in most states, I know in Virginia and here in Pennsylvania where I am, you can get it through a state order. You might have to pay for it, or you can get it for free at a lot of distribution sites. And you can be the one to help turn that potential fatal overdose into a non-fatal overdose, and we can help people regain their lives. But to go back to some of the data, is there any particular demographic data that you were able to see? Really, how do demographics play into overdoses particularly?
Sure. So for our population in general, we saw that COVID-19, or I mean, this is across the US, COVID-19 has really disproportionately impacted underserved minority populations in terms of rates of the COVID-19 pandemic, hospitalizations, and death. And with this data, from our sample, we found that opioid overdoses have actually also disproportionately impacted Black patients. So the percentage of Black patients that had a non-fatal opioid overdose increased from 63% last year to 80% this year. And that's a pretty alarming trend in a population that's already experiencing really sad and alarming disproportionate rates of COVID-19 associated issues.
Absolutely. And it's yes, it's hard to think about having both of these things kind of happening simultaneously. I was able to do something with the NIH earlier this year that talked about syndemics. So all of these different types of pandemics and epidemics that are happening together and kind of worsening because of each other. And I think that opioids and COVID, or opioid overdoses and COVID, really are two things that we see that are going together in this really dangerous way. And so I really do appreciate you really bringing this to the forefront, getting this on people's minds. But for people who potentially are either battling substance use disorder right now, or maybe have a family or friend, or family member or a friend who are, what would you tell them in terms of seeking treatment, places that they can go? What would be really your suggestions for them?
Sure. So I think prevention through Narcan and
Mhm.
naloxone is obviously a huge thing. I mean, you're a certified naloxone
Mhm.
provider, right? Or you're
Trainer,
trained to
yes.
administer. Yeah, as am I. I think that's really helpful for anyone to do. It's pretty easy. There's virtual training.
Mhm.
So if you know someone that's battling addiction, or even if you don't, I mean, I think nearly everyone knows someone that's battling addiction. I think that's a really helpful,
Mhm.
life-saving thing that they can do is being able to have access to Narcan and then knowing how to administer it if someone is overdosing, because I mean, it can just reverse it like that and
Mhm.
save their life. And then the other thing is obviously opioid agonist treatment or medication assisted treatment, as it's
Mhm.
often called. So with buprenorphine or methadone.
Yeah.
So there are treatment centers, and those significantly reduce the likelihood that someone's going to overdose again. So those are two really important things. And then I would say, so there's a really good resource out there. It's a website. It's
Mhm.
hhs.gov/opioids, and they have a lot of information on prevention,
Mhm.
um, a lot more resources and information about the different treatment options that are available for people. I mean, I just mentioned two because we don't have a lot of time,
Mhm.
but
Absolutely.
there are other options like rehabilitation, inpatient options. So I think it would be really good to um, get educated about those different treatment alternatives.
Mhm.
And then there's just more information about the opioid crisis in general. And another great thing about that website is it actually has a list of virtual resources and virtual recovery resources
Mhm.
that are especially salient in today's time of social distancing.
Yes.
So I think that's a really, really helpful thing to look into.
Awesome.
What
Yeah.
about you? What
Sorry, go right ahead.
do you have any experience from your Mind the Meds, Mind Your Meds platform in terms of like other treatment options or other options that someone might look into when trying to help
Yeah.
their loved one or someone they know struggling with addiction?
Absolutely. I think one of the most important things is having open communication in your family and with your friends because there is so much stigma associated with addiction in general and substance use disorder. And one of the things that I hear all the time that I would love for you to help our listeners understand is well, if someone is taking a drug, why can't they just stop? They can just choose to stop. And how inaccurate that is and how that propagates stigma within our communities to say, well, this person has made a bad choice and continues to make this bad choice because either they don't care, they don't worry about their family or their friends. And there is science behind addiction and substance use disorder and how it affects our brain. Can you share a little bit about that? Because that's a
Sure.
really common misconception that I come across.
Yes, yeah, it definitely is. So, one example that I often hear is you wouldn't take insulin away from someone who has diabetes, right? You would give them their insulin. It's a chronic disease. So, just like diabetes, opioid use disorder is a chronic disease. It's a
Yeah.
disease of the brain. And fortunately, it is being more recognized. Unfortunately, there is still some stigma
Yes.
underlying it, but it is a brain disease and medication is very efficacious. It's not just something that um, people can stop doing, you know, in a snap.
Yeah.
So, I mean, there's a lot of great like resources available to treat this brain disease and
Mhm.
um, yeah, and I think a big part of addiction in general, especially opioid use disorder, is people continue to take opioids because they have developed withdrawal symptoms.
Yes.
And that's what really perpetuates the process of the continued opioid use, is because they're not taking it to get high anymore after a certain point. They're really taking it to maintain um, normalcy and prevent themselves from getting sick. So
Yeah.
I think that is, a huge thing that individuals out there need to
Yeah.
understand.
It's a mental and physical battle. And I think
Yeah.
that the more through my experience as Miss America and formerly as Miss Virginia, understanding and talking to the people who have been afflicted by addiction, and substance use disorder, particularly with opioids, and understanding that fight of withdrawal, and wanting to stop mentally and saying, I really don't want to do this to myself anymore, and I can't stop on my own. And I think that that's one of the biggest things that I think I've learned through this process, is that not everyone's recovery looks the same, but the biggest thing that you can do is to start. And especially if that is really someone helping you by starting, and giving you Narcan, and bringing you back and giving you that opportunity to seek recovery. There's also many misconceptions, I think, about Narcan out there. Can you explain a little bit just how Narcan works for people who don't particularly know in terms of the brain, and why Narcan is so quickly able to bring someone back from an opioid overdose?
Sure. So I wish I had one with me, but I actually used to. But I mean, there's like different types, but the one I know of that many people carry and you can get at the pharmacy is it's like a little,
It's like
I
the
don't
little
know.
nasal spray.
Yeah, like a little, if you use Flonase, if for allergies, it's similar to that.
Yeah.
I mean, even smaller, but there's just like a little plunger and you just like spray it within the nostril.
Yeah.
And I mean, people generally, when they're administered Narcan, they generally, if they are overdosing on opioids, they wake up just quickly. And I mean, it just reverses. So it knocks off the opioids like off of the receptors, and that's how it reverses it. So an opioid overdose is mainly due to like respiratory depression. So people stop breathing, they turn blue, they have like pale skin, and it's really scary. And I mean, I've seen people get Narcan in the emergency department, and I mean, it's amazing how instantly it works. It's really crazy. And then paramedics might administer it through the vein, which is another way. But I mean, just Narcan in general, there's like a nasal spray, which is very effective. And it's very easy to administer.
It's amazing. And exactly kind of what you were saying. I love that it's almost like this miracle that knocks the opioid right off of the receptor. I kind of always joke that it's kind of like magnets. It's like having one magnet that's kind of strong and then another magnet that's a lot stronger that takes over that receptor and brings your abilities back. But to go back again to your research and your paper, what do you hope that everyone watching takes away from the research that you guys have done, particularly with COVID? What are your overarching messages throughout this process that you've learned and want everyone to know?
Sure. So we just really wanted to share this data with the public, and I mean, especially people out there in the community, and in the local Richmond community, but also across the country. Other places might be experiencing the same surge, and they are experiencing this surge in opioid overdoses during the pandemic. So what we wanted to really tell people is that we need to work together to help spread the word of different resources, different effective treatment resources that are available in the community, either virtually or in person, and just connect people with those life-saving resources, and tell them about different efforts to prevent opioid overdoses. So that's really what we wanted to spread. And then I know you are doing the Mind Your Meds initiative, and I'm sure you can talk more about that, but I think that's a really, really fantastic platform that you're involved in. And a lot of opioid use disorder starts with a valid prescription for an opioid. Throughout my career, that's really what I've seen, is that, I mean, especially in grad school, I think 90% of our patients, their opioid use disorder started with a valid prescription from an opioid, and then they abused it or they stole it from their parents' like medicine cabinet, and then it just turns into this long-term, really awful struggle with addiction.
You're absolutely right. And I think there's a statistic that about 2/3 of patients who are prescribed prescription opioids actually end up misusing them in some way. And that's something that I think that I'm hoping to prevent through education, in this year. And also what you're saying in terms of taking from the medicine cabinet is another one that becomes an issue that's preventable. And so people are able to actually safely dispose of those opioid medications if they ever have them left. And that's another thing. Most of my campaign is educational at this point. And it's so necessary because people don't know what to do in certain situations. And we see so many people with medicine cabinets full of old pill bottles that you're not using anymore. And for anyone watching, National Drug Take Back Day is going to be happening again next month. It happens biannually through the DEA. And I've gotten to partner with them. And so make sure to start clearing out your medicine cabinets. There's usually safe disposal locations at your local pharmacy or police station. But Taylor, you're absolutely right. That is one of the ways that people become addicted to prescription opioids, maybe that aren't prescribed to them. But there's so many people that even are taking these prescriptions and don't fully recognize the addiction potential, because it is even sometimes more than just a psychological addiction. We were talking about that withdrawal and having that physical dependency that starts to form, even if you're taking it as prescribed.
Right.
And I think that that's important to look at too, because sometimes that can perpetuate or maybe be the catalyst to substance use disorder in so many people.
Yeah,
and so
absolutely.
It's sad that it's something that continues in our country, and clearly is something that is worsening during the pandemic. And I think that it's so important that we bring this to light. And I appreciate you focusing on this, because I have been running around the country trying to tell everyone and shout from the rooftops that this is such an issue. But if anyone watching is struggling with substance use disorder or knows someone who is, definitely that HHS website is a great one. Miss America organization has also partnered with the Recovery Village. They're another great resource nationally. If you are struggling with substance use disorder, please reach out to them, or to me. If you need to be in a direction, I can help you put you in the right direction is a great one. But this is an issue that's not getting better right now, unfortunately.
Right.
And
there are virtual resources available, which I mean is fantastic.
And so telehealth is great. We can Zoom with doctors. So don't use the pandemic as an excuse not to get help, because there's help available for you. And Taylor, I just wanted to thank you again for coming on here with us. I do think that we had one question pop up that I am going to stick in here. And the question is, you mentioned that the study took off because of the frontline workers. Do you think that there is a future for industry and research collaborating?
Yes. So industry and research collaborating, is that what it says? Yes. So there's definitely a future for that. It is something that we're doing, like my team here at VCU. So we have a project that's been ongoing, and we partnered with Indivior. It's a pharmaceutical company. And what one of our studies is with Indivior is that we're actually giving Sublocade. I don't know, I'm sure you've heard of it as a pharmacy student, but Sublocade, it's a long-term, long-acting buprenorphine injection. So buprenorphine is one of the medication-assisted treatment options that I mentioned earlier. And so we are giving patients or offering this treatment option or this study for patients who have just experienced a non-fatal overdose in our emergency department. We're offering them this Sublocade shot, and it's just like a shot that goes right in the stomach, and it lasts an entire month. So they don't have to remember to take buprenorphine pills daily or worry about losing medication or getting it stolen. I mean, it's just a quick shot. And so we're trying to rapidly implement rapidly connect patients with this Sublocade treatment. And we have a bunch of like different experimental options and clinical studies that we're looking into, but that is one of them, because these patients are so vulnerable. They just experienced this horrifying event when they overdosed, and they're scared, they're confused. And so it's just something that we can offer them. And I think it's really great. And then we connect them with the outpatient treatment facility that's affiliated with VCU, and we see them, and we've had some really great outcomes. And I mean, we've just seen so many patients really respond well to this, patients who were who literally like died for a minute when they
Hmm.
overdosed. And then, just being able to see their lives turn around, even during this pandemic, which has just isolated people and really turned their lives upside down. So it's been really a cool study that we're looking into. So we do have industry sponsors
That's amazing.
that we're working with.
It's a great example. And so important right now, this entire research project that you're doing, talking about mental health, how that's propagated, the substance use disorder throughout the country during this time and in general. And so thank you again, Taylor. I know we are out of time, but thank you for taking the time to come and join me today to talk about your paper. Where can people watching actually find and read your article?
That's a good question. So it's on like JAMA. If you just go to JAMA.com,
Mhm.
or I think it's like JAMAnetwork.com, you can find it. It's kind of like hard to find actually
I'll
because I
post
was
a
trying to
link in the
describe it.
comments for
Yeah,
people to grab it
um,
after they watch this video. I think everyone
sure.
would love to read it, and I'll post it on my social channels as well. So everyone is able to see the great work that you guys have done.
Perfect. Thank you so much for talking to me today and
Of
for all
course.
of the great work you do as a fellow woman in science.
Thank you, Taylor, and I will see you back in Richmond when I'm back.
All right. Bye.
Have a great day.
You too.